Welcome to this video. In this video, I will share with you the strategies and tips that you can utilize if you are about to start your residency training. Although this video is based on the rules and regulation and the health system of US, however, you can apply many of these tips and strategies to your residency training regardless of the geographic boundary. Hi, my name is Dr. Farzana Haq. I'm an assistant professor of medicine. In this video, I will share with you the lessons and experience which I have learned during my internship and residency in the US, and also the experience which I've gained through teaching medical students, interns, and residents who are both international medical graduates and also US medical graduates. My goal is to incorporate important tips so that you can avoid some common mistakes. So if you do not want to make those mistakes and if you want to stand out, keep watching. I will share my screen. So what you will learn in this video today? At first, you will learn the expected responsibilities of an intern. Then the workflow of US health system. Then the common mistakes done by the international medical graduates, particularly during the intern year of their US residency training, because international medical graduates, they are not familiar with the US health system compared to a US medical graduate. I'm very much fan of this quote that maybe I'm not there where I want to be, but at least I'm not there where I was yesterday. If you are watching this video after you got your residency, congratulations. And if you are watching this video on the way of your residency preparation, congratulations, because give yourself the shout out because you truly came so much far from the day you decided to start your USMLE journey. So in this video, I will share with you valuable and useful 15 tips so that you can stand out during your residency training, and also some useful resources that you can use during your intern year. Full disclosure, I do not have any financial relationship, all these resources. So it's very important, firstly, to understand what is the expected expectations from an intern. So before we go there, let's see what will be the typical work day of an intern if you are doing an inpatient rotation in a hospital, and it could be community or university-based hospital. First, before you start your day, it is expected that you will take the sign out from the night team. And after that, you will review the morning labs, patient chart, and then go see the patient. Place the initial orders, and then round the patients with your attending. And after you decide and get the instruction from your senior resident and attending, take the appropriate order, complete the note, follow up the labs, talk to the family, nurses, other team, and give the sign out before leaving the hospital. So it is very important to understand the predominant styles of rounding. You can round in a room with all the medical team, which is referred as table round. Or you can round exactly in front of patient room or inside the patient room, which is known as bedside round. Remember, if you are doing the bedside round, it's better to have all the essential data in hand so that you can include when you are presenting the case, because inside the patient room, maybe you will not always have the computer access. And also be prepared to stand majority of the time for rounding. So wear comfortable shoes. So let's learn what is the expectations from an intern. Concise case presentation, formulate differential diagnosis, initial workup. You are not expected to diagnose a very rare a zebra disease. However, you are expected to formulate the initial diagnostic workup and give the preliminary test and management. And then think about the discharge plan, which I will discuss more within few minutes. And also complete the required workup, follow up the labs, follow up all the orders that you were assigned to complete. As an intern, you have to follow up so many things, and sometimes it's very easy to lose track. However, take the ownership of your patient, because these patients are somebody's relative, loved one. So take the ownership of their care, because it's truly a privilege that we can take care of these patients. Always have checklists to make sure you have completed your task before you leave the hospital. This tip I found extremely important during my residency training and as an attending physician in a big academic center, which is understand the baseline. Understand the baseline of mental status. For example, you will see a lot of patients who will come to hospital for acute encephalopathy or acute change in mental status. If you do not know the baseline mental status, it could be just waste a lot of money to do the workup for already diagnosed dementia. Few months ago, I had a patient who presented due to acute change in mental status. Patient is confused. I cannot ask him. Patient did not have family. So I reach out to patient's primary care physician. And primary care physician told me that patient has dementia. So this is nothing acute change in the mental status. Imagine if I would not have known that this is patient's baseline mental status, he has dementia, I could have easily wasted a lot of money to do the workup of this mental status change. And also creatinine, because you will get so many patients who will come to hospital or in the clinic with increased creatinine. So find out, is this acute change? Is this acute kidney injury, or patient has CKD or chronic kidney disease? EKG changes. Remember, there is drastic difference in management if it is new diagnosis of left bundle branch block or chronic left bundle branch block. So the tips will be always compared with the previous EKG after you have done a EKG for your patient. And then CBC. Okay, if the patient has thrombocytosis, leukocytosis, leukopenia, always compare it with the previous lab to find out, is it acute or chronic? And secondly, how much it has changed, because intensity is also important. When you are doing your training, you will prescribe a lot of medications. Imagine you prescribed a medication and 15 minutes later, your nurse told that your patient ended up like this. How would you feel? Always check for allergies before prescribing any medications. You may say, okay, so the electronic medical record should give me some flag. Yes, you are right. However, remember, no system is perfect. Every system has some flaws. So take the ownership and check for allergies before prescribing any medications. If you are giving any medications that can increase the QTC interval, check patient's QTC interval from the previous EKG before giving that medication. Always double check route, dose, and frequency of any medication. Because when you will prescribe medications in the electronic medical record, sometimes it may show as milligram or milligram per kg. So be mindful about this unit when you are prescribing or putting the order for medications in the EMR. And always include antibiotic stop date in the order as well as in your progress note, so the other team know when the antibiotic will be ended. Truly with you, electronic medical record or EMR will be your best friend during your training. So learn your EMR, either it could be Epic, Cerner, or whatever the electronic medical record you will get in your hospital. Learn inside and out. And also ask for the template of note from your senior resident, like template for history and physical, progress note, and discharge summary. So let's now focus on patient's discharge process, because either you are intern, resident, attending physician, you will discharge so many patients. And understanding and planning the safe discharge process is critically important. So my mentor asked me that when should I start planning for patient discharge? I did not know that time. So my mentor told me that from the admission day, start planning on how to discharge a patient safely. Remember, I'm not telling you to discharge the patient as soon as patient admitted. I'm telling you to start the process, the thinking process about safe discharge on the admission day. Find out what is the major complaint, which things you need to do to make this patient better, what are the obstacles or what are the issues you need to clarify or resolve before discharging this patient safely. After I started my residency training, I was very surprised to see that patients are not only going to home, they are going to nursing home, they are going to acute rehab, long-term acute care, or LTAC. So usually nursing home, they get around like less than 3 hours physical therapy, around 5 days in a week. Rehab will be 3 hours physical therapy 5 days a week, and long-term acute care or LTAC, where patients get like ventilator management, very intense, complex wound care. So I was trying to find out how these patients are getting determined that, okay, who will go where. So I found out that the solution is looking at the note of our physical therapy and occupational therapy colleagues. Majority of the hospitalized patients, particularly who are very debilitated, weak, more than 65 years, they undergo evaluation by our physical therapist and occupational therapist colleague. And they decide that, okay, which patients are stable enough, safe enough to go to home after discharge, or which subgroup of patient will need to go to nursing home, acute rehab. So I found out that answer. So then my next question was, okay, so to whom I should reach out for these patients who are going to home or rehab? The answer is, which is very important, patient who will be discharged to nursing home, rehab, contact your social workers for those patients. And those patients who will be discharged to home, contact case manager. Hopefully, these simple 2 lines will be beneficial for you, and you do not have to spend that extra time, which I spent during my internship, to find out what is the responsibility of social worker and what are the responsibilities of case manager. Understand the chain of command. Medicine is a hierarchy system. You must and you should reach out to your senior residents with any questions, support, concerns. Definitely, you can reach out to your attending physician. At the same time, your first go-to person should be your senior resident. And always learn, observe from your senior resident and attending physician. For example, learn how they are handling a difficult patient and angry patient, or which patient who is asking for pain medications frequently. Learn their skills so that you can develop your skills from them. I cannot stress enough how much important it is to become a good listener. We have 2 years and 1 month for a reason. Feedback. None of us is perfect. And during your residency training, you will see, after every rotation, you will receive both verbal and written feedback. Feedback is a gift. When I'm teaching my medical students, interns, residents, I sit with them one-to-one and ask their specific feedback about my teaching style, about my work style, so that I can learn from their input. The truth is, as human beings, we have blind spots. And sometimes maybe other people are seeing something we are not seeing. So that's why it is very, very important to welcome and learn from feedback. It's not maybe always easy, because as human beings, after learning something negative, it's definitely hurt us. We are human beings. At the same time, successful people are those who do not take feedback personally, but learn from them. Ask for help when you need and you are not sure. Because everybody knows that you are new, you are not expected to know everything. However, patient safety comes first. So please take ownership and ask for help. Ask for the questions if you are not sure. No question is a stupid question. Every question is important question. If you are starting your night floor rotation, or at least you have to do 1 to 2 months of night floor rotation during your internship. So a couple of points here I would like to emphasize here, that for night floor rotation, sign out is the key. So be attentive when you are taking sign out and ask for the sick patients, specifically from the day team. Ask them that, okay, do they have any particular instructions if any patient get decompensated? Then if the nurses are asking you to see any patient, please take it seriously, go to bedside and see the patient. Our nursing colleagues, they are working hard. They want to do their job properly, and truly they are not calling you because they think that you have nothing to do. Everybody are trying to do their job. If you are getting a call, please go to bedside and assess the patient. And if there is any significant overnight events, always document it and also communicate it verbally. For any significant overnight events, the communication need to be two-way. One, written, second, verbally with the day team. Rapid response and code blue. Rapid response team usually get call, particularly the on-call team, that if the patient need any immediate rapid attention. Don't be surprised if you end up running like this for rapid response or code blue to reach the patient's room. And for code blue, they usually call if the patient is having cardiac arrest, patient need intubation. As an intern, you are not expected to lead the rapid response or code blue. However, follow your senior resident's instruction. Maybe your senior resident wants you to review the lab, review the most recent note, order some labs, or reach out to patient's family. So follow your senior resident's instruction. Be available and prepare to give chest compression or CPR. And most importantly, learn that how your senior resident and attending is conducting the rapid response or code blue, because next year you will be the resident and you will lead this rapid response and code blue. Document properly and timely. In the US, if you did not document, that did not happen. Doesn't matter how much time you spend for a patient or how much work you do. So please document and do it timely. Complete the discharge summary on the day of the discharge. I know sometimes it's hard if you are so much busy on call day. Believe me, if you do it on the same day, it will be much faster and easier because the information is fresh in your head. And the more you will do documentation, you will make progress. Particularly if you are coming from a different country like me and starting your internship, there will be a lot of teeny tiny tips to improve your documentation. So welcome that, adopt it to your documentation and improve. Medicine is a team sport. So know the whole team. Medicine does not only mean the physician. We have our nursing colleagues, our advanced practice providers, physician assistants, and nurse practitioner colleagues, our social workers, case managers. So respect them, know them, show them your genuine appreciation. Know your nurses, particularly nurses for your sick and complicated patients, so that you can reach out to them easily. And your colleagues. Many days you will spend more awake time with your colleagues at the hospital than your family at home. So have professional relationship with your colleagues. If you are having any gathering, any family picnic, please join your colleagues. And sometimes if you are on call, not possible, inform them earlier. It's very important to have collegial relationship with your colleagues. And I will also recommend you, maybe after 6 months, if you are so much busy during your intern year, to be involved with a lot of professional society like Society of Hospital Medicine, American College of Physicians. I am involved with both professional societies, and I truly enjoy going to their regional and national meeting because I can learn, I can see my colleagues, I can interact with my colleagues, and it's truly a great opportunity to broaden your network with the skilled physicians. Be aware of HIPAA. Patient information is critically important and you must keep it confidential. So if you are printing the patient list, do not lose it. Because when you are carrying a lot of pen, paper, but please be cautious because this is patient's information, you cannot lose it. Do not leave the medical chart open in the EMR and go for coffee. Be sure that other patients or relatives are not seeing the medical chart or information of another patient. And never ever discuss about patient information in the open space like elevator and cafeteria. Please be cautious. I cannot stress enough how important it is to be respectful about our patients' information. It must be highly confidential. There will be a lot of educational sessions, morning report, grand round. Please join those. And for journal club presentation, I have made a separate video that how would you do that journal club. So if you want to learn more, please refer to that video. And choose an article that you feel comfortable, that you will be able to present, and keep it concise so the audience can follow and remember something from your presentation. Be on time. Personally, I believe that 10 minutes before the scheduled time is on time. I know be on time, this is a old school rule. Everybody's parents told them, but still sometimes we may miss it. Be on time is very, very important. I'm a big believer of Oprah Winfrey's quote that we must be full at first in order to serve others. So self-care is so much important. So take care of yourself first to serve others well. You need the energy to serve our patients and community. Sleep. How much important is it? You are a physician, you already know. Snacks. Pack some healthy snacks, particularly if you are going for a long night shift or on-call day. Vacation. Many interns will tell me, oh, Dr. Hawk, I will do some reading or prepare for the exam during vacation. Please keep vacation as vacation, because after doing so much hard work, you need that break to enjoy your time and spend some time with family. And family come first. Although you will have a lot of responsibility, lot of sometimes challenges in the hospital. However, family are blessing in our life, and we must be caring for them. Remember your handy tools like portable phone charger. If you are going for a long shift for on-call day, pen. I think I lost so much pen during the intern year, so I have more pen, at least 3 or 4, and a small blanket, particularly for your on-call night. Sometimes I say that all the on-call room are cold. I don't know, maybe it's just me. However, have that small blanket, so in case if you feel cold, you can have something to put on. Learn driving if you are moving to a place where the public transport is not available, like New York, Chicago. And if you are moving to the place for your residency training, please stay close to your hospital, and you will think later for saving your commute time. The final tips will be mindful. You are highly professional, and that's why you are preparing for USMLE. You are at this stage, you will become board certified physician in the US. Such a remarkable and outstanding achievement. So please take ownership and be mindful of your emotions, your words, your actions, and what you share with other people. It's very important to be respectful, to be courteous, and to have collegial relationship, professional relationship with your co-workers. At the same time, remember that you are a physician and they are not your friends. The useful resources, no financial relationship. First, if you are going for the internship anywhere, regardless of the country, read these 2 chapters, admission and top 10 workups. I read the first 10 chapters of this book before I start my residency. If you do not want to read these 10 chapters, I believe if you read these 2 chapters, it will be useful for you. And then if you do not know some answers, always refer to UpToDate, because majority of the hospital make UpToDate free of cost for their faculty and trainees. And finally, you will see that many of the interns and residents use this book, pocket notebook. This book has like a small table and charts to do the focused workup. For example, which test to order for pleural fluid analysis after patient had thoracentesis. So I hope that these useful resources will be valuable for you. In summary, take the ownership of your patients. Ask for help when you are not sure. Document properly and timely. Learn from feedback. Feedback is a gift. And the most important point here, I would like to emphasize that enjoy your training. It's a privilege. You have worked so much for this day, for this training. So enjoy every moment, because now you have earned it. So I hope you found this video valuable and you will be able to use these lessons during your internship, your residency. If you like this video, please click the thumbs up button. Share this video with your friends, with your colleagues whom you believe will be benefited. And please subscribe to this channel. There will be a lot of other valuable contents for you and for your career. I wish you all the best, and I will see you in the next video. Until then, take care.